Look, I'll be honest, abortion is like my least favorite issue to talk about. No matter where you stand, somebody within your own party is going to try to scream at you for it. But since Democrats are wrong on how it relates to this issue particularly and the recent news of it, here we go. Back in August of 2022, Amber Thurman, a woman from Georgia, traveled to North Carolina to seek an abortion after discovering that she was pregnant with twins. Now, Georgia doesn't permit abortions past 6 weeks. They have a heartbeat law, but they do have exceptions in cases of the life of the mother. And this was not one of those cases. Now, ProPublica, a nonprofit publication, recently obtained the summary narrative of Thurman's hospital stay from the Maternal Mortality Review Committee, detailing that she did arrive actually very late to her appointment at the clinic in North Carolina. And because she was late, they instead gave her abortion pills that are legal, not only in North Carolina, but also in Georgia, instead of the scheduled abortion procedure because she was late. 4 days after taking the pills, she started vomiting blood and passing out. Now, the pills she took did kill both babies, but she did not pass all the fetal tissue. It's a known side effect of this. She was warned. Back in Atlanta, she arrived at the hospital 4 days later at 6:51 p.m., but wasn't seen until 9:38 p.m. I'll tell you why the wait was so long in just a minute. That's going to blow your mind. They gave her an IV and some antibiotics and diagnosed her with acute severe sepsis. She was then scheduled to get surgery to remove the remaining tissue, known as a DNC, legal in Georgia. But about 20 hours after she initially arrived, did they actually go take her into surgery? 20 hours. At that point, she was already in organ failure, and it was too late. She died on the operating table, unfortunately. Now, why? Democrats will tell you that it's because of the overturning of Roe v. Wade, but it's not. A recent report from the Georgia's Maternal Mortality Review Committee ruled that her death was preventable. So obviously, as the left says, never let a good crisis go to waste. The report from ProPublica is blaming Georgia's abortion law, but let's look at the facts here. ProPublica writes that Georgia made performing the procedure a felony with few exceptions. But DNCs are not illegal in Georgia unless used to intentionally kill a child in the womb, which was not the case here. This DNC surgery was legal in Georgia, hence why it was conducted in Georgia. ProPublica, though, baselessly pegged pro-life causes as the reason for the delay in the surgery, but the doctors have provided zero evidence of that. And then there's the fact that sepsis is a known side effect of the Democrat-pushed abortion pill. But then, of course, no shock here. Harris is trying to use this to her benefit on the campaign trail, saying, quote, "This is exactly what we feared when Roe v. Wade was struck down. In more than 20 states, Trump abortion bans prevent doctors from providing basic medical care." First of all, there are no Trump abortion laws. That's what the Supreme Court said, because the overturning of Roe v. Wade made it a states' rights issue. So Donald Trump, even if he wanted to, couldn't make a law. But more so, why aren't we asking why she waited 2 hours after coming in and throwing up blood everywhere and then passing out? Maybe it has something to do with the fact that hospitals are overrun by illegals. And according to census data, 184,000 of them just in the Atlanta area, all of which are using the emergency room as their primary care doctor because they're uninsured. Also brought to you by Obamacare. This is the product of making healthcare a right. 2 issues caused by Democrats led to her death, not Trump. How about let's find out why she wanted the abortion in the first place? She already had a son, and she reportedly wanted to go to nursing school. Perhaps she couldn't afford another child or 2. Maybe it was because of the economy. Her best friend even noted in the article that she felt stable in her life and didn't want to risk that. But none of that matters to Democrats because it doesn't fit their narrative. There was no legal issues preventing any of the procedures from getting done the way they were conducted. There are notable risks to all of them, but she should have survived. The failure was in the delays and the post-treatment. But this is the party that's trying to blame Trump, even when they can't define life. I also, side note, find it ironic that this is the party that will refer to bacteria found on Mars as proof of life, but refuses to admit that aborting a baby at 7, 8, 9 months is taking a life. Dr. Frank Contessa, internist at Custom Care Medical and Trauma Emergency Dr. Kelly Victory. Kelly, so many failures on so many levels, zero of any of which had anything to do with politics.
Absolutely. Thanks for having me, Carl. It is preposterous for anyone to assert that this young woman's tragic death was the result of an abortion ban anywhere. The reality is that she went to neighboring North Carolina to get the abortion where it would have been legal for her. And because of apparently her own delay in getting there, they offered her instead a medical treatment rather than the surgical one. But the reality is this: her death was the result of a delay in her care when she went back to Georgia, having nothing to do with abortion whatsoever. She had already had intrauterine fetal demise. The pills she took resulted in the death of the fetus. She effectively had aborted that fetus or had killed it, and it was the delay in her care once she showed signs of sepsis, of overwhelming infection, which there was absolutely nothing preventing the doctors in Georgia, other than perhaps an overwhelmed emergency department, from taking care of this young woman the way that she should have been cared for. It had nothing to do with an abortion ban in any state by anybody.
Dr. Frank?
I agree completely. You know, this case is really not about the law. Unfortunately, it's about medical malfeasance. You know, listen, I'm the last person to want to blame the doctor when things go wrong. You know, medical malpractice is a scary word. But this was a clear case of negligence. When a person comes in clearly in sepsis, which is blood pressure falling, organs failing, that's not something you wait until tomorrow to take care of. So when I reviewed this case as what's publicly available, there was no excuse for that woman to not have had the DNC immediately. This is to kind of clear the decks, get everybody out of the hallway. We're running to the OR right this second. This isn't like, well, let's see how things are tomorrow. So the blame here falls squarely on the doctors who were in charge of her case, and it's criminal.
Yeah. And Kelly, the problem here is, you know, they're using this to scare a bunch of people. It says, well, this is the product of Trump. You're going to die. But it's like she used procedures in states and in various areas that are perfectly legal by state legislature. But also, these are the real risks that they're not telling you when you take these pills.
Absolutely, Carl. This has become the modus operandi of the left, to weaponize fear of whatever it is, whether it's fear of a virus or fear, in this case, that something horrible is going to happen to you because we have overturned Roe v. Wade, which means nothing more than that we've turned that decision over to the individual states. But the left will never let that be. It is disingenuous, let's just say at best, for them to suggest that this had anything to do, as Dr. Frank said, with an abortion law. This was medical malpractice and the delay of treating her sepsis. And the idea that people are going to die as the result of overturning Roe v. Wade is ridiculous. Frankly, I would submit to you, had this woman not been pursuing an abortion, had not been pursuing to terminate her pregnancy, she would still be with us today.
Right. And Kamala Harris hadn't one mention of the two dead children that passed because of this abortion bill. Dr. Frank, Dr. Kelly, appreciate it.
Thanks, Carl.
Thank you.
All right, coming up, Gavin Newsom signing